groups, hard to reach groups, were not effectively reached, and that needs to be kept in mind. So, final words. I think COVID-19 can definitely be an opportunity for social protection to build back better. The wave of interventions that was implemented has given social protection a lot of renewed momentum and traction. And really now it's up to national governments, international donors and agencies, as well as other stakeholders to seize the opportunity and continue that momentum on social protection. Thank you.
Excellent, Keetie. Thanks so much. Okay, let's now move to Sohela Nazneen, who is another IDS Research Fellow, and she has contributed the article to the bulletin on gender. Sohela, over to you.
Thank you, Peter and Mary, for asking me to speak today, but also thanks to IDS and Irish Aid for enabling myself and Susana Araujo, who's my co-author, to write this article. So our article focuses on gender equality and whether if you want to build back better, how do you put gender equality at its core? And what are the dilemmas that arise? Partly we look at in terms of talking about dilemmas because the feminist collectives that we were working with are worried that we will actually go back to business as usual, or that building back better would be built on women's backs. So I have three things that I want to point out. The first message is we are at the risk of losing the gains that we made on gender equality and women's rights. And that spans across sectors. We know about the impact on health, and this is a public health emergency. But when you cut down on secondary health services, sexual and reproductive health is affected, outreach services are affected, and that affects women and girls quite a lot. We know about the silent pandemic, which is the rise in domestic violence incidents across the world, but there are also other types of risks and gender-based violence in contexts that are quite fragile. For example, trafficking in girls have gone up. There are also other issues in terms of women's economic empowerment. So sectors have been hit hard where it's female dominated, for example, service sectors, but there are also vulnerable groups of people, women migrant workers, women refugees, women in informal sectors who don't have formal job security, who are being hit hard. And the burden of care has gone up for all classes. It's not just about homeschooling. There are other types of care work that you need to take care of and attend to the elderly and the sick, and while also try to be economically active. So it's a stretch. And lastly, of course, there are the issues that these things are interconnected, so you just can't address one separately. So that's one message of the bulletin, that it looks at the article that looks at the impact. The second thing that it talks about is how are we doing, or how have we done? So the article obviously has data up till September, but things have also progressed since then. So how are we doing? Not very well. There is a global tracker that UNIFEM has, and globally, we have 225 task forces, and women are only 24% of these task forces, and mainly in Europe and Latin America and the Caribbean. There are places in the world women are not part of these mini sites of power where decisions are being taken. The second bit, in terms of, yes, social protection has been ramped up. If you analyze it, only 11% of them actually take unpaid care into account. That's a very important area if you want gender equality. Domestic violence sort of measures around that. The rhetoric is there. Government and others are talking about it. When you really analyze it and see what is being done, not enough. Given the scale of the problem. So we are already falling behind, and we really need to push hard. So that brings me to the third message of the bulletin, which is how do we do it? And you already heard that it's kind of circular, it's not linear. But one aspect is, of course, when you're facing an emergency crisis, how do you ensure that you have an understanding of the gender-specific impact of the crisis with an intersectional lens? Not all women are affected in the same way. They're affected differently, depending on elderly, whether you're a minority woman, whether you're domestic, your class position, etc. So how do we ensure that our emergency measures are taking the different vulnerabilities into account? And the bulletin talks about that. The second second bit is if you're going to build in terms of medium and long term, both for the donor agencies and policymakers and at the national level, you need three types of capacity. One is your technical capacity to do gender analysis and focus on the problems. Second is your fiscal capacity, because you do have to invest. Third is, of course, the political will to do so, and it varies across contexts. And for us to build the capacity and to take the measures, we really need to think, where are the progressive alliances? Because this is a political decision. And the last message that I want to leave you with, and this comes from the Canadians, which is basically that there is no recovery unless there is a she-covery. This pandemic has had grave impact on women and girls. It is a gendered pandemic. I'm not saying men are not affected, but we are not going to recover or move back from business as usual unless we focus on she-covery. I'll stop there.
Thank you so much, Sohela. And that's a great phrase as well, which we should take to our hearts and take away from this event also. Now, moving on to our next presenters, Ayako Ebata and Nick Nisbet, both IDS Research Fellows, and they have contributed to the article on food equity. And I think, Ayako, I'll pass to you.
Thank you, Peter. And once again, thanks very much for Irish Aid and also IDS organizers for hosting this event, as well as helping us through the bulletin articles. So I'm presenting our work on food systems, which was co-authored by Nick Nisbet, as well as Stuart Gillespie, who are both here today. If there's one message to take away from our part of the presentation, then it is about equity in food system resilience. And I'll talk about that in the next 5 minutes. Across the world and over the last year, you have seen sweeping measures that were put in place in order to slow down the spread of coronavirus. And we have seen a lot of measures that are affecting food systems as well as in other sectors. So for example, we've seen a lot of closures of markets. Social distancing rules have affected a number of different actors within the food systems, as well as people's accessibility to healthy and nutritious food. What we're seeing and what we continue to see today is a series of ripple effects, let's say. So this public health crisis, like COVID-19, has affected different parts of supply chain and their functionality. And as Sohela actually quite nicely said, they are also affecting care arrangements within families and households, and the social networks beyond that. Which then affected the accessibility to healthy food, as well as information and the support that marginalized people were able to access before the crisis rolled in. And basically what this is all telling us is that the food systems and other systems are lacking resilience. And this is not necessarily a new piece of work that we have done or anybody else has done in relation to COVID-19, but it has been talked about in terms of climate change and other sustainability issues within food systems and beyond. So resilient food systems are able to absorb, respond to, and recover, and potentially also thrive from shocks like COVID-19. And it's actually quite important to thinking about thriving from crisis and making this as an opportunity. However, resilience thinking can lead to further marginalization of already marginalized group of people. And that's obviously what we're talking about in this bulletin article, as well as the webinar. And in order to avoid that, and again, thriving from crisis to work, to make a system that works for the marginalized and the furthest left behind, we need to think about equitable food systems as well as resilience in it. What do we mean by this? Basically, what we argue in this article is that equitable and resilient food systems need to evaluate who wins and loses, who are the winners and losers of whatever interventions that we are putting in place, we are considering in the political spectrum. And that would hopefully lead to interventions that can support the most in need. We analyzed this from two particular topics, which are malnutrition and food systems jobs and related poverty. So first of all, to tackle malnutrition, we suggest a holistic approach that takes into account these individuals' care environments as a social being rather than just an individual person living in the individualistic life, let's say. So, for example, access to healthy food requires individuals to have time, but that is crucially related to the kinds of job that she or he has. If you don't have enough time to make healthy food at home, obviously you're not going to be able to supply that to your families. And also the wider water and sanitation environment is very critical in making sure that individuals don't get diseases and other health conditions from consuming food. We also critically analyze that there's overemphasis on these individual-based interventions, but also focus on staple commodities and increasing the quantity of staple commodities. And this has been talked about as silver bullet points for food security, but we argue that this is not necessarily enough to build back from COVID-19. When it comes to the income generating activities within food systems and poverty from food systems perspective, addressing systemic barriers for people to access resources as well as information is very critical. This can be general remoteness that is common amongst particular groups of people who tend to be marginalized, but also access to information at the time of crisis and beyond. And then we also argue for fostering local capacity to innovate and communicate information across relevant stakeholders. And finally, we emphasize the importance of political influence to tailor interventions that support the most marginalized people. So let me stop here. And if there's any questions, we would be happy to address. Thank you.
Thanks, Ayako. And if questions do come up later, I know we have Nick Nisbet also here, and I'm sure that both you and he will be able to give a word before the end as well. So thanks for that. Now, in the bulletin, we have a number of papers which look at really thematic issues. We've heard a number of those represented today. And we have also some contributors who are based in a number of countries who have really shared experiences from the ground to help us understand better what the implications of COVID are really playing out at national levels. So now I'm very happy to ask Kim Mwamelo, who's Reproductive Health and Nutrition Programme Manager at the Embassy of Ireland, Tanzania, and contributed one of those papers looking at enhancing nutrition in Tanzania, to share your thoughts with us. Kim.
Thank you so much, Peter. Thank you for all the brilliant work that you and Mary have done on this, and for all the participants, thank you for taking your time to be with us. So it was been quite interesting being near the last to speak, because a lot of our lessons are actually quite similar to what has been learned from the global space. I think talking back to the country level perspective, one of the key lessons coming out from our experience has been the need to rapidly respond at the local level based on the local context of the pandemic. And this really needs resilient health systems that can then be leveraged on to respond to the pandemic while still addressing the needs, particularly of the most vulnerable. In Tanzania, for example, Irish Aid supports a broad range of interventions at local level, including community system strengthening, primary healthcare services. And based on the local context, we have interventions around gender-based violence, gender equality, water and sanitation, as Ayako had mentioned, and social protection. And so one of the things that we're able to do really quickly is leverage all of these interventions to provide relatively holistic services to the communities that we work with. There is an important need to safeguard the services, particularly of essential services, particularly for women and children. Tanzania's healthcare system is already quite overburdened and under-resourced, and there is a significant risk of the entire system shifting to address COVID-19 and essential services dropping off of the map. In order to be able to safeguard services, it needs a bit of flexibility, adaptability, and learning from the actual situation on the ground. And I think, Melissa, you touched on this in your introduction quite well, that the actual local context differs significantly. However, that doesn't mean that we should not try to ensure services are available. Our focus primarily is on women and children. And so depending on the areas that we're working in, this meant maybe identifying locations in health facilities for people to access care, maybe one-on-one services in the community, maybe a combination of all of these. Essential for us was as well protecting healthcare providers, speaking to the resource of the healthcare resources. We do have nearly half deficit healthcare system in terms of human resources. And so looking at the system as a whole rather than separate chunks and ensuring that the needs of the most vulnerable, particularly women and children for us in Tanzania, is key. I've talked quite a lot about local level action, but just before I close, I'd like to finish on issues on coherence and coordination, particularly from a donor perspective, around interventions that are designed and are supported need to align with national government plans and policies, but also there is a role there for policymakers to ensure that our investments and our support also aligns to best practice globally. But there is also need for coordination within the donor space and within the donor communities to ensure that we're all working on separate pieces of a whole, rather than multiple different projects coexisting in the same physical space. So I really think that this conversation has been very timely, and I'm looking forward to learning a bit more after reading the wonderful bulletin, and happy to answer any questions in case there are any. Thank you.
Thank you so much, Kim. So we've now heard from our contributors, and I'm just really glad that this session is being recorded and will be available afterwards, because there's such a wealth of insights and experience being shared. And now an unenviable task I'm going to pass to Michelle Winthrop, Policy Director at Irish Aid, just to share a sense, Michelle, of what are you taking away from all of this, and to give us some further thoughts to consider as hopefully everybody will read the bulletin.
Thank you so much, Peter. Gosh, yes, unenviable indeed. I think the biggest takeaway really is, and it has been repeated a few times, is that actually this represents an opportunity to fundamentally reframe how we are approaching development, how we see it, how we identify problems, and how we bring about solutions. The Sustainable Development Goals are still valid. The framing of the goals is still right. But I think we're all agreed on this statement that's in the bulletin. Nothing could be worse than a return to normality. And everybody's relationships have fundamentally been altered for the last year. People's relationships with nature, people's relationships with their governments, people's relationships with each other, with their families. And I think we should build on that. I think we should take this opportunity and really push ahead for a sort of turbocharging of creativity and lesson learning. To give you an example, indeed, in Ireland, only today the government has announced that we're going to try to use the beloved rural Irish pub as an opportunity for remote working, actually. And, those buildings that would be empty during the day, because people in the pub during the day isn't a good thing, right? Let's use those as an opportunity to pull people out of the cities and use those spaces productively and allow people to reconnect with their sense of home. So, that kind of creative thinking, I think, is really what we should be pushing for. Some of the threads I think I picked up on, I think that this point about the pandemic bringing into sharp focus the barriers to people accessing services and really the identification of those marginalized people, what it means to be furthest behind first, and what it is that puts you in that category. We're seeing it in terms of gender, but we're also seeing it in terms of ethnic minorities, religious minorities, people whose faces don't fit. And I think we're really beginning to learn how we can take a sort of people-centered approach and engage those marginalized groups in the process of policy making. I would contend, and you might expect me to say this as a representative of the Irish government, I would contend that human rights is back as a concept. Often rights gets kind of pushed to one side as a bit complicated and a bit theoretical. Actually, if you frame the challenge in terms of basic human rights, it really does start to help you prioritize. Many colleagues have mentioned that the interconnectivity across our various areas of work. People do not live their lives in sectors, and indeed, if you take a people-centered approach or a household-centered approach, family-centered approach, you can start to build public policy and deliver services in such a way that they interact with each other for well-being outcomes over and above economic prosperity. We are, something that hasn't come up as much, and something I'm slightly obsessed with, is that the pandemic has brought about a change, I think, in intergenerational dynamics too. It has brought about a conversation about what a quality childhood means. It has brought about a conversation about aging and how we age and how we provide support for those people who are at the latter stages of their lives. And I think that, again, is something we should seize upon, really, for an honest conversation with ourselves about how we deliver from the cradle to the grave. And that goes back to the universal social protection point. For Ireland as well, I think it's taught us that we have to move a little bit beyond our money as donors. And the aid programme should be the money plus. And indeed, our learning, our expertise, our own experiences. Developed countries, I think, have been reminded that we are all in a process of development, and you know, the pandemic has set us back on so many levels that we've had to re-question some stuff too. So I think it's brought us into that space where the universality of the Sustainable Development Goals really is meaningful and not just a kind of token political signal. And then the last point I would make is that I believe very strongly that the pandemic has brought multilateralism back into focus. How we feel about multilateral institutions, our degree of ownership of them, whether we are for them or against them, you know, at least it's brought a bit of energy into that conversation around the role of multilaterals. Who would have thought that in a year's time, practically everybody could name the senior management team of the World Health Organization? You know, and yet here we are. The European Union, as will be of no surprise to anyone, I think, is really asking itself some difficult questions around our internal versus our external priorities as a bloc. So it's proving a bit of a, I believe, a bit of a junction, a reflective junction when it comes to multilateralism as well. And as you all know, that's something that the Irish government holds very dear. But I would say learning is the most important thing that we can do in this phase. And so on that basis, I'd like to really express my sincere thanks to IDS for a fantastic initiative and a fantastic way of weaving it all together. We, I know, have really benefited from the process, and I know we will benefit massively from the product too. So thank you so much.
Michelle, thank you so much for those remarks, and speakers, thank you also so much for your comments and also for keeping to time, which does leave us around 10 or 15 minutes to look at some of the questions which are coming up in the chat. And I would encourage people to keep posting questions in the chat. So I'm now going to read out just a couple of them and perhaps suggest who might respond. So we've got an interesting question here from Ray Hirayama, who asks all the panelists about the intersection between quite complex social protection issues as they've unfolded in earlier ostensibly health crises, HIV, Ebola, other infectious diseases, and is wondering to what extent the COVID crisis, and perhaps particularly the social protection response, has been able to draw on learning from some of these earlier sort of intersecting health and other crises. So that might be one for Keetie, if you could come back to that one and offer us some thoughts. And then there's a question to Sohela from Alex Vandy, who asked you to kind of, in a way, sum up a little bit what you've said about is COVID-19 an opportunity or a crisis for gender-based violence, or for action against gender-based violence, depending on which way you take it. So it would be good to hear that. And then I wonder, I mean, who might like to pick up? We've got two interesting questions about kind of furthest behind first, but who needs to be prioritized. So we heard from Sohela the call for this to be a she recovery. Nisbet is saying, I would also say we need a child-centered recovery. And then Mary Wickenden has said, waving a flag for people with disabilities who, as predicted by many, have also had their marginalization and underprivilege and disadvantage exacerbated by COVID. And of course, people living with disabilities are often the biggest but the most marginalized of so-called minority groups. So I wonder, I mean, if one or two of you would like to reflect on this, in a sense, who are we prioritizing if we're thinking about the furthest behind first? Who is actually furthest behind? And perhaps how do we deal with what are intersecting forms of marginalization and prioritizing those? So that might be something perhaps for Mary to pick up on in terms of how Irish Aid thinks about these things. So let's have some responses. Maybe Keetie, if you want to start on the social protection one.
Sure, thank you, Melissa. So a very interesting question, and I'll reflect on it specifically from the perspective of lessons with respect to HIV. And I think there are lessons that were learned from that response, and thinking about how social protection can then respond to COVID. I think first off, I think it's been an important one to really instigate the social protection response to COVID. There's been many lessons from the response to HIV in terms of how effective social protection and particularly cash transfers can be in helping people affected by HIV and, for example, in adhering to their medication, but also preventing infection in certain groups. So I think that evidence has really helped also promote this response. I think a second lesson is probably around targeting. I think a lot of lessons within HIV-sensitive social protection have shown that very stringent targeting, so really trying to limit the group to those who are most affected, can also have a backlash and negative consequences. And I'm thinking particularly here around stigma, on which we've also done a separate piece of work. And that actually relates also to responses to other infectious diseases, such as Ebola, where very stringent targeting and singling out of groups and people can really undermine the effectiveness of this support. And I think maybe that's also played into some of the wide sweeping response that we've seen in this case with respect to social protection. I would also like to point out one thing that's I think is quite different from other pandemics, if you will, and that is the sheer scale of this crisis, the scale of the socioeconomic consequences that I think is unlike anything we've seen before. And that's not just at national level, but also the connections between the national and the international. So global supply chains being disrupted, meaning that garment workers in Bangladesh or workers in flower nurseries in Ethiopia and Kenya having lost their jobs, etc. I think that's very much unlike other crises where I think there's a lot of learning from COVID.
Excellent. Sohela, do you want to pick up on the gender-based violence point?
Sure. Thanks, Alex. That is an interesting question. Do we look at what are the problems, or do we think about how do we move forward? In a sense, whether COVID-19 is an opportunity to address and change the way we address gender-based violence depends on how we respond to what is going on. I mean, no doubt COVID-19 is a unique scenario. I mean, you have prolonged lockdowns, you're locked. For example, let's take domestic violence. So you can't go anywhere. The services are suspended. And obviously your exposure to risk of domestic violence rises. And then different kinds of gender-based violence would have different types of risks of being heightened because of cuts in service, because of how we sort of set up redressal measures. And it's not usually the way it functions, right? But having said that, there has been innovative practices. So for example, for women to sort of text emojis to the crisis sort of hotlines instead of having to type a whole message if they are in close quarters with the perpetrators, or on-camera court and digital processes in places which didn't have them or were slower to put in these measures. Repurposing hotels for domestic violence shelters, things things have been done, but things have been done sort of in a localized manner, selectively, and not sort of thinking in a coordinated way. So the question for us at the national level, but also sort of in terms of thinking about the international policy space, is that how do we learn from these examples, and how do we ramp it up? Because violence against women is not going to go away, and it is going to be heightened as we face increased poverty and economic stress. So we need to think out of the box. And it is an opportunity to think out of the box, I think.
Yeah, okay, excellent. So I wonder who'd like to pick up on these questions about sort of intersecting forms of disadvantage and how those might be addressed. I mean, perhaps Mary and also Kim, I don't know if you'd like to offer any thoughts from the national perspective in Tanzania about gender, disability, child-centeredness. How does one work with these intersecting forms of marginalization?
Kim, do you want to pop in and I'll then supplement, or do you want me to give the kind of the more overarching view first?
Sure. Just to speak on the issue around gender and the response, I think one of the government's initial early priorities was to mitigate the impact or the increased GBV, the expected increased GBV during this time, especially in light of the fact that economic activities would have been interrupted. It was still uncertain whether or not there would be a lockdown. And so one of the things that we supported really early and the government prioritized was to have a hotline that was for Corona, but had a specific response and responses around gender-based violence. And interestingly, the gender-based violence component of that was used a lot more than the broader coronavirus response. I think around disabilities, there's still quite a lot of work to be done there. There's national frameworks, of course, and a lot of work being done around, for instance, ensuring that speeches and stuff are made in a way that they're accessible for people perhaps with some disabilities. I do think that there is a lot of work and just
I think we've lost Kim connection.
From the sub-Saharan African context.
Right. I think we're possibly losing Kim. I don't know if Mary is anything
in particular to disagrify some of these women. My apologies. Can you hear me now?
Yeah.
Oh, sorry, friends. Just final issue around data disaggregation, the availability of data around disability for planning and for implementation, to be able to actually identify, as Mary had said, that is a huge challenge still.
Yeah. Okay, excellent. And Mary, I don't know if there's anything you'd like to add either on that point or just more generally as a final remark.
Yeah, not a huge amount to add to Kim's intervention. I'm glad the connection caught up. But I suppose it's just to make the point that when we're talking about furthest behind first, we are talking about real people, that we need to get beyond just the rhetoric of this being a batch somewhere here. And it's also about more than simply targeting. Because of course, if you're designing an intervention for somebody else, it doesn't stand much of a chance of actually being correct or useful or sustainable in any way. So it's about, when we talk about, I think, disadvantage, it is the intersection. So it's not just all women, it may be women in particular situations and contexts who are in a particular ethnic minority group. The intersection with disability, as some people have made the point in the chat box as well. So it is the intersection of different factors that cause marginalization. And it's also those voices that are silenced from discussion, from discourse, and from decision making. So all of us have blind spots. I'm sure, you know, so it's about ensuring that we are listening to those voices of people who are most affected. So if those are malnourished children, who is speaking for those children, and where are we hearing those voices and how are we factoring them in? It's women who can't access healthcare. It's smallholder farmers. It's ethnic minorities. So it's, I think there's been some interesting research recently on the kind of gender makeup of COVID-19 task teams around the world, and the dearth of female voices in terms of the public health response in different national governments, with really disastrous responses. So if people who are most affected are not at the heart of decision making and design, then really we need to start over again. And that, I think, needs to be at the center of this sort of transformational thinking and response that we are.
Great. Well, I think that's a really important point to underline as we move towards the end. So we're running out of time. I just want to draw attention to two final points which are coming up in the chat and also appeared, I think, in all of the discussion and indeed in Michelle's remarks. And one of them is about the importance of the local. So we are seeing I think, across all these questions of intersecting issues, the local context really matters, and who's involved and the way these patterns of disadvantage and these intersections play out are really going to differ. And I think as Haley is pointing out in the chat, and as the first health focus piece in the bulletin pointed out, there's still so much we don't know, even within the health sector, about how COVID is intersecting with other health conditions. And that's going to be really important to know and be able to respond to into the future, especially as COVID becomes an endemic disease, which seems very likely. So the local absolutely matters. And Mary, as you've said, involving the furthest behind in those local decision-making processes is vital. But so too does the global. And I very much agree with Michelle's remarks about COVID has pointed to a new prospect of kind of multilateralism and global solidarities. At the same time, it's also revealed, I think, the strains in those. And there's an interesting intervention in the chat about what we're seeing around vaccine nationalism and countries actually turning in on themselves at a moment of crisis as well. And I think this double tension is going to be something to watch out for over the next period. Also over this next year, when of course the world is going to need to come together around climate change and around the economy more generally in a post-COVID moment. I'm very aware that the UK is hosting both the G7 and COP26. And I think my final point, again, picking up on a lot of what others have said, is about universalism. I think if the COVID crisis shows us anything, if the bulletin shows us anything, it's that the challenges, the crises, the opportunities affect everybody everywhere in different ways. And the UK and Ireland have as much to learn as Tanzania or Bangladesh or any of the other places and contexts which are discussed in this bulletin. So this emphasis on learning and moving forward collectively, I think, is really vital. So thank you so much to all the contributors to the bulletin, those who are here today and who presented, those who are not here. Encourage everybody to read it. There are some really great articles there. Keep the conversation going. And enormous thank you to Mary and to Peter and to Irish Aid for enabling this partnership, which has produced this and made the conversations continue. Thank you all so much.